Hey everybody, we're going to talk about over-the-counter medications today. This is going to be kind of a short um, lecture, and then I'm going to have you guys do some research. So what I want you to do, first off, is I want to discuss what over-the-counter medications are. Over-the-counter medications are medications that can be sold safely without a prescription, without being monitored by a doctor every 3 months, 6 months, or a year, that aren't going to impact severely other systems if they are taken appropriately and taken by the directions. There are always very specific manufacturer directions, and patients need to follow those, and you need to be sure you tell patients that. Also tell them to be aware of the follow-up information, which says if they're taking ibuprofen for a fever, if the fever does not resolve in 3 days, they need to see a physician. If they're having pain that they're taking ibuprofen for without a doctor's order or without seeing a doctor for more than 7 days, they want to follow up with a physician. So make sure that you're aware of those. Let's talk about the different kinds of medications over the counter, because there are tons of over the counter medications, as you saw with your reading. So they're going to be categorized and set up generally in a pharmacy based on what they do. So they'll have fever medications, cough and cold medications, antihistamines. And they'll have them set up like first aid medications would be things like Caladryl, calamine lotion, antibiotic ointment, hydrocortisone cream, and then other supplies like for basic wound care supplies like bandages, Band-Aids, things like that are going to be on the same aisle usually. Then you're going to have an aisle that has dietary supplements like vitamins, minerals, those kind of things down an aisle. You're going to have diabetic kind of medications, which may have glucose testing strips and glucometers. Usually on that aisle they'll have other medical equipment. They may have canes and walkers and crutches. They may have basic splints, back braces. They may have blood pressure cuffs, thermometers. They may have pulse oximeters on that aisle. Then they'll have an aisle that has respiratory kind of meds, which may have over-the-counter asthma medications like Primatene. And those may be with the allergy medicines as well. So know that they're going to be broken down into certain categories. And as you did your reading, I hope that you found that there were multiple categories and lots of over-the-counter medications. You're not going to know every specific medication. Also, you're not going to know every brand name and every generic name. But know that for most over-the-counter medications, the pharmacy will sell, just like with prescriptions, there'll be a trademark medication and then there'll be a generic medication. So an example is if you work for Walmart Pharmacy, they're going to have Advil liquid gels, but then they're also going to have their own brand like Great Value, or they're going to have Walmart brand over the counter. Dollar General is an example. I'll show you. They even look the same on the outside. So Dollar General sells Advil liquid gels, and then they sell DG Health over-the-counter ibuprofen as well. So there's going to be both. They're equivalent for the most part. If a patient brings them both up to you, you're going to show them and talk to them about the active ingredient. That's what actually works on the patient's systems. The inactive ingredients are used for preservatives and binding and those kind of things. You want to make sure that the patient is aware that there'll be a package insert, which pretty much the package insert, like they do, the monograph that they have for pharmacists is very different than what they put on or in boxes of medication or on the back of medication. It's very, the monograph that is given to a pharmacist is basically goes from the molecular level with all of the information. It's usually a huge piece of paper. For someone in the home, it's actually written generally on the back of the box, or sometimes it'll have a fold out that will come open from the package itself, and it will have information that's on the level of about a sixth grade reader. So that, they can't change the way to pronounce the generic name, but it'll give them basic information about it. It'll talk about medications you shouldn't take it with. Like an example is if you take St. John's wort, which is a herbal medication for that is promoted for depression, it shouldn't be taken alongside an antidepressant. So you need to make sure that you're aware of those things, and patients will come and ask you, can I take this with my medicines? Well, you as the pharmacy tech, you're going to have a list of their medicines, and lots of times you can put that in a database and it'll tell you whether they should or shouldn't take it. If a patient asks you about those medications, you want to tell them, don't take more than the recommended daily allowance. So you want to tell them, if you're taking Tylenol, you want to be sure that you're not taking more than 4 grams of Tylenol a day. It can be difficult, be hard on your liver, it can cause liver damage. It says that clearly on the packaging. So be sure that you tell them to take what the recommended dose is based on the package. For ibuprofen, we know that there's 800 milligram ibuprofen as a prescription, but over the counter they recommend 200 milligrams for an adult twice a day. Same thing for pediatric meds. You want them to follow the chart for based on age on the back of the bottle. We know as healthcare providers that ibuprofen can be given based on weight, but that's not how it's sold over the counter. Over the counter, it's sold to be given in very specific increments. There are very specific directions based on dosage. Be sure when patients ask you, you're very clear that that is all they're supposed to take. Be sure that when it's an over-the-counter medication that patients understand what the specific interactions are, and that they understand that active ingredients are what the body uses. That's what's actually in it that's going to affect the body. Inactive ingredients, like I said, are just those preservative kind of medications or flavoring. Be sure parents know that over-the-counter medicines for an adult should not be given to a child unless the doctor has ordered it. Be sure that they understand. And in your pharmacy, things are going to be set up that way. You're going to have cough and cold medications, cold and flu medications. You're going to have pain relieving medications on one aisle. You're going to have fever. You're going to have first aid medications and first aid supplies on an aisle. You're going to have medical supplies, which could include walkers, bedside commodes, in some places canes, crutches, splinting materials. It may include blood pressure cuffs, glucometers on the side where they may have other diabetic supplements and diabetic like glucose gel and glucose tabs. Glucose testing strips may be all together, but lots of times they'll be around where the other medical equipment is, thermometers, those kind of things. They're going to have cough drops. They're going to have nasal sprays. They're going to have all kinds of medications. They're going to have over-the-counter stool softeners and reflux medications, stuff for your stomach. They're going to have stuff for your skin, medications for your skin in a certain area. So as you can see, there's a huge amount of over-the-counter medications that are sold in a pharmacy. And as the pharmacy technician, you're going to be aware of the category because you've learned them for the medications that are behind the counter. But you have to be aware of what they do, what those active ingredients do from behind the counter. So you're going to spend some time today kind of putting those into categories. And this is what I want you to do. And I'm going to give you an assignment that's going to post and give a little better description. What I want you to do, because there's no way I can go over every. We would spend a whole week just going over about a third of the over-the-counter medications. So what I want you to do, you're going to do a little bit of research. You're going to use the over-the-counter reading that I gave you both, and you're going to make a grid. You're going to make a table that will just use a Google Doc and insert a table, and it's going to need 3 columns. And the first column is going to be labeled over-the-counter drug category. The second, actually it's going to have 4 categories. Over-the-counter drug category, and in that drug category, you're going to put things like fever medication, topical anti-itch medication. You're going to go through your over-the-counter reading and look at the categories that are in there. And then on the second column, you're going to put brand names, and you're going to list at least 2 brand names of that category. Antitussives, which would be like Robitussin or Mucinex. You're going to list 2 generic names, and then in the third column, you're going to list at least 3 types of generic brands, which would be like Dollar General Health Value or CVS Care Value. You're going to put that in the second column. In the third column, that's the third column. In the fourth column, you're going to list the active ingredient for those medications. So you should have the active ingredient. If you've got Tylenol, the active ingredient is going to be acetaminophen. If you've got Robitussin, the active ingredient is going to be guaiacocin. So you're going to list the active ingredients. I want you to go through and I want you to use all of the categories that are in the over-the-counter reading, and I want you to list a brand name, 2 brand names, 3 generic names, and the active ingredient. So you should have a table that has 4 columns, and it should be grouped by that. So you'll on the first column you'll have the drug category. The second column will have brand name. The third column, the heading would be generic name, and the fourth column would be brand name. That is going to be due at the end of class tomorrow. So be sure that you work actively on that. This is a short, I know it's a short lecture, but it's the best way for you to start remembering what those meds are. When you put them down on paper, when you have that, when you make a table, when you create something with those, it's easier for you, just like with those flashcards, for you to remember them. All right, guys, have a great day, and I'll be back with you soon. Thank you, guys.